Mm. Okay, ladies, just a moment right here. You're live?
Good evening, everyone. I want to start off by saying thank you for joining us tonight. You could have been anywhere, you could have been scrolling on any other social media platform, but you chose to stop by here to listen in on this conversation. So thank you so much. My name is Annie McLymore. I am a board member with a nonprofit organization acknowledged as Trophy of Life, where we render hope and encouragement to individuals, not just in our specific sphere of influence, but to the world. And before we get started, I need y'all to do me a favor. I need you. So we're not just on this Facebook platform, but we are on a YouTube channel. So I need you to go to YouTube and I need you to search Portia Wheatley Trophy of Life, all one word, and like, subscribe, and share. Okay? Thank you. And we are going to get started. Um, so, our Facebook post, if you've seen it, gave us a preview of what we're going to be talking about tonight. But just in case you didn't see it, here it is in a nutshell. So, this conversation is going to be about Black women's health and the quality care that every woman deserves. We'll be discussing topics such as postpartum recovery, perimenopause, menopause, and midlife wellness, Black mental health disparities, and how to advocate for yourselves and to find healthcare providers who truly listen to you. Because we all know that's important. So, as my social media people say, let's get into it. I would like to introduce my guest on tonight. I have the privilege of having Dr. Sha'llah Brewton with us tonight. Dr. Brewton, just to give you a little background on her, Dr. Brewton is a family medicine physician with a dedicated focus on women's health. She's the founder and chief medical officer of SBMD Healthcare, which is a package based direct care practice that supports women from post puberty through perimenopause and beyond. Dr. Bruton is committed to a collaborative approach to care, working alongside her patients to form treatment plans in a trauma informed and culturally humble way rather than a direct rather than directing that care from the top down or like a one size fit all approach. She prioritizes empowerment, patient education, and shared decision making, helping each individual take an active role in their health journey and helping them to maintain a thriving, balanced life. Now, listen, y'all. Dr. Bruton is not just a doctor that I stumbled upon. She's not a doctor that someone referred me to. She happens to be one of my best friends. We've known each other since we were 12 years old. So yes, it is my honor to have Dr. Bruton on the line with us tonight. So Dr. Bruton, thank you for taking out time from your busy schedule to be with us and have this conversation with us.
Of
Hey
course.
girl, hey.
Hey, I
How
am
you doing?
honored to be here. I'm good. Thank you. Thank you for
That's
inviting me onto this onto this Facebook Live.
You're welcome. All right, well let's get into it, okay?
Let's do it.
So listen, let's start from the beginning. So, from the time that I can remember in high school when we were talking about careers and what we wanted to do um, when we grew up, I remember you talking about wanting to be a doctor. At the time, you didn't know what kind of doctor, but you knew you wanted to be a doctor. And I know sometimes, when we're in college, uh, we change majors every so often. We change our minds about what we actually want to do once we start getting into the studies. But you seem to have stayed along that path of, yes, I want to be a doctor. So let me figure out how to do that, even through like the obstacles that you may have faced with different colleges, right? But you still stayed on that path and you figured out how to push through and become a doctor. So tell me what sparked your interest in medicine? And was there a moment when you knew that, you know what, this is the path that I was meant to take?
Well, for as long as I can remember, I always wanted to be a doctor. My mom said I was watching like a Nova show on PBS about something about neuroscience, and they were showing brain material and stuff, and I was just eating spaghetti, and she was like, she knew at that moment that I was going to be a doctor. I was really young. I was like 4 or something like that. And she's like, she didn't understand how I could stomach that. But as far as I was concerned, I don't know if hearing that story kind of helped to put it in my head, but I always wanted to be a doctor. Sometimes I wanted it would like fluctuate of what else I wanted to be as
Hmm.
well, like a doctor or an actress, a doctor or a hairdresser, a doctor or
Hmm.
a dancer. And in
Hmm.
college, like dance was part of my major as well as pre-med, right?
Right.
So
Yeah.
that was like a really serious possibility, dance. But I got a little nervous about being like starving artist type of a thing. And so instead of like
Uh-huh.
getting my master's in fine arts for dance, I was like, we're gonna stick to the thing that's a little more that's a little more like stable. So
Yes. Uh-huh.
that's why I went to med school. So I knew I wanted to be, that's what kind of solidified that, along with having like a GYN issue myself. And the
Hmm.
provider that took care of me was so caring, and so like she took her time to explain things to me, and um, just like really make sure I understood, and I wasn't as like, because to me I was like, oh my god, I'm dying. And she was
Hmm.
like, no, no, like this, these are the steps, like this is what we're gonna do. And she just really took her time to calm me down, to make sure I understood things. And I really felt like cared about, not just cared for, but cared
Hmm.
about, right? And
Yeah.
not only did I decide at that time that that's the kind of doctor I wanted to be, like I wanted to help women, but I also wanted to be that type of provider that listened to people, that really paid attention to them and took what they were saying seriously. Um,
Right.
and then that coupled with another GYN provider that I had that was like the exact opposite. He wasn't like a, he would explain things, but just the way that I just didn't like his bedside manner, I guess you can say, just to
Hmm.
make the story short. And so, like, you learn what to do and you learn what not to do, you know? And so I was like,
Hmm.
we definitely don't need more of him in the GYN space. I need to get him in the
Right.
GYN space because, you know. So that's what helped to solidify which type of doctor I wanted to be.
Right. Yeah, no, that makes sense though, because
Yeah.
we all have different experiences when we go into that doctor's office, and it definitely shapes how and the way that you want to be towards your patients as well when you're practicing. So yeah, I get that totally. One of the reasons I was excited to have this conversation with you, listen, I talk to you about medical issues, that kind of thing. So you're my personal doctor, even though I'm not your patient. But I know that you have a passion for Black women's health, and um, we deserve, more attention. We deserve to have someone there that listens to us and really pays attention to what we're saying. Um, so, from your perspective, what do you think some of the biggest challenges are that Black women face when it comes to receiving quality healthcare?
That's a good question. Um, and I'm going to preface it by saying that I feel like everybody, Black women, all men, have
Mm-hmm,
issues with accessing quality healthcare in our
mm-hmm,
country just because our healthcare system is broken. It is so broken. So like those first issues are like getting in, right?
mm-hmm,
Like how long do
mm-hmm,
you have to wait to get an appointment? And then once you've waited those couple of months for an appointment, um, are you rushed through or not? Most of the time you're rushed because it's not because doctors don't care. It's because
mm-hmm,
we truly do not have the time to take the type of time that we need to take with patients, right? Like when you are within the healthcare system, including like having insurance being your major payer, you have to see a
mm-hmm,
certain amount of patients a day in order to keep the lights on in your office, right? Like, and
mm-hmm.
so a lot of times that means you're seeing 4 to 5 patients, sometimes 6 patients in an hour, which means we're talking about 15, 10, 15, maybe 20-minute visits. Um, and it's just not enough time. It's not enough time when somebody's been like gathering up all of their stuff that they need to talk to you about over the months that
Mm-hmm.
they've been waiting to see you, right? Like
Right. Yeah.
it's ridiculous, right?
Yeah.
Um and so then a lot of times we find ourselves like in an urgent care with a provider that doesn't really know us, and also you're supposed to be rushing through urgent care visits. They're supposed to be even faster, right?
Mm-hmm.
Um so that's like a problem that everybody has. So now you got through all that, you're at your appointment, your fast appointment, and maybe it's not with a provider that you really trust. So that's one of the things in our society: racism, systemic racism, implicit bias,
Mm-hmm.
overt bias, right? Like
Mm-hmm.
just the history of inequity and care that just hasn't been for us leaves us with a big distrust of the system, right? And
Mm-hmm.
so finding somebody who you feel comfortable with is even harder for a Black woman or a Black patient in general, right?
Right. Mm-hmm.
Um, and so that's why that's also part of the reason that I wanted to become a doctor, so that there were more people that look like me to serve people like me.
Right.
Um, yeah, because even for myself, I find myself seeking out Black women doctors because that's who I feel most comfortable with. And studies
Mm-hmm.
have shown that people do much better when they have a doctor that looks like them.
Right.
They trust them better, so they're more likely to follow the plans of care that have been set up, and just they just trust the information more when it's coming from somebody who like kind of culturally understands them.
Right.
Yeah.
Yeah, no, that makes a lot of sense. And I know it's not a guarantee, right? Just
Right.
because they look like
Right.
me doesn't mean they're going to give me the best quality care
Right.
that I need. However, I think it makes you feel more comfortable when they do look like you, because you do feel like, okay, they'll understand where I'm coming from when I
Right.
tell them about this issue. And I
Yeah.
know for me, when I talk to you, like if I have an issue and I come talk to you, I've had issues where they look like me and I explain to them what's going on with me, and they just give me this blank stare. And I'm like, okay, so
Yeah.
where do I go from here?
Right.
And I'm like,
Right.
so what is that about? You know?
Right.
So I think that it's still, I still find myself seeking out doctors that look
Yeah.
like me,
Yeah.
regardless of those issues that I ran into earlier in life
Yeah.
anyway.
Yeah. Because bedside manner, speaking to what you're just saying, bedside manner, it comes naturally. And if it's not the right type for you as a patient, as a receiver of the healthcare system,
Hmm.
right? Then it's still, no matter what the race of the provider is, you're still not going to feel comfortable. You might be more comfortable and more apt to like kind of advocate for yourself when the
Hmm.
person looks like you. But if they're not giving you the type of care that you need, they're just not doing it. And
Right.
there really is that kind of pressure to hurry up and get people out to so that you
Hmm.
can get the next person in.
Hmm.
Unfortunately, the
Yeah.
system is not set up for, what's the word I want, for quality care. It just really isn't. Unfortunately.
Yeah.
That's why I
Yeah.
started my
And that's,
business.
and we appreciate you. We appreciate that.
Yeah.
Let's talk about postpartum recovery for a second. So, you've had a child, and I know others who have, had children, and we tend to celebrate the baby, right? And rightfully so when it comes. But sometimes the person that gave birth kind of gets overwhelmed, overlooked, and we just kind of forget about them on some level.
Right.
What do you wish every um, woman, Black woman, knew about caring for herself after the delivery?
That it's okay for her to care about for herself after the delivery, right? Like,
Mhm.
um, there's a quote from, there is an organization called oh, it's just left my mind. PSI, Postpartum Support International.
Okay.
Um, that is an organization that really helps with um, mental health in the perinatal time, which means during pregnancy and afterward, for like the year afterward, kind of.
Hmm.
Um, and the like president, a past president and education and training director of PSI had a quote that says, I love this quote: "In our lives, we have seasons of giving and seasons of receiving. As a new parent, you are in the season of receiving."
Mm.
Right? Like that
Yeah.
is what I wish every new parent knew. Because when you think about it, if you just had a baby, you're thinking, I'm giving, right? I have to take care of
Hmm.
this baby. I have to feed the baby. I have to make sure the baby is clothed and fed. That's really pretty much
Hmm.
all they do, right? Is eat, eat, sleep, and need a diaper change, right? But like, the mother or the postpartum parent is also healing from a huge change, a huge life change, not only physically, but mentally and hormonally.
Hmm.
There's huge changes, and not only that, but you also have a new role, especially if it's you're a first time parent. But even
Hmm.
if you're going from one to two kids or two to three, that's still a big change. There's a big difference in your household, and you need the time to rest so that you can heal and fully take care of that child, the new being in your home, right?
Hmm.
So, um, this kind of goes along with what else I would want a postpartum parent to know is also just during the pregnancy, make sure that you are building your community for that postpartum period, right? Like
Yes.
everybody that comes into your house during the postpartum period should be helping with something, not just holding the baby. You could hold the baby. I mean, if you want to bathe and use the bathroom and all that, yes, holding the baby is important, right? But they're not there
Right.
just to coo over the baby. They're there to help you. They are there to cook
Hmm.
a meal, to clean a floor, to wash a dish, something, right? So that
Yes.
you can focus on feeding the baby and resting yourself. So that is that is very important, and it goes into the I know you asked me for one thing, but there's so many more. There's
No,
so many things.
it's okay.
It
You're
goes
good.
into the next thing that is just like mental health,
Hmm.
especially in the Black community. We There's so much stigma, really, in any community, but in ours especially, that mental health is very important. And when you don't get enough sleep, it can make it hard for
Mm,
anybody.
yeah.
And we all
It's
know that,
hard to function.
right, in the postpartum period, you're not getting enough sleep. You're just not. That
Hmm.
baby is up every couple hours, and so you're not getting enough sleep, right? And if you have people that can help so that you can rest and sleep and just do the bare minimum, right? Then you're
Hmm.
going to feel much better. And don't be afraid to talk about the mental health things that might be coming up for you, the feelings that might come up as far as feeling anxious, having intrusive thoughts about
Hmm.
bad things that might happen to the baby, feeling scared about that. They're actually, those are really, really common thoughts to have,
Hmm.
but a lot of people don't talk about them. And it's important to talk about them. And it goes back to the whole safety thing. If I
Right.
if I talk about feeling like I'm scared to walk down the stairs while I hold my baby because I'm scared I might drop her, or I'm scared that I don't want to bathe my baby because I'm scared they might drown. Like, is somebody going to call CPS on me? Which is something that we have a huge problem with in our community. CPS
Yes.
gets called on us at much higher rates than it does for our white counterparts, right? And so it's a
Hmm.
true fear. It is a real fear, but
Yeah.
that can oftentimes have us kind of hiding away our mental health to detriment of everybody in our household, including ourselves. So
Yeah.
those are the things that I really would want postpartum mamas to know about. Postpartum
That's
parents.
great. Yes, parent. Yeah,
Yeah.
that's great information. Because we do, especially that mental health part of it, we do tend to hide, our feelings and what's going on. And we need to have that safe space that we can, whom someone we can talk to, or our community that we can talk to, and to get strength from them as well, encouragement as
Yeah.
well from them. So yeah, I totally agree with that. So listen, you and we're getting up in age here. We might look young, but we we are teetering on that halfway mark here.
Right, right.
And so we're about to be 50, and there are things that I remember hearing my mom, my aunts, great aunts, talk about. And I kind of was a little confused about it, but the only thing I knew was hot flashes. The only thing I knew was mood swings. And I was just like, I hope that happens like much later on in life, right? But I really didn't know like what age it would have started. I didn't know what happened before then. I just figured, you get up to a certain age and then all of a sudden life changes for you.
Right.
But in conversation with you and our other mutual best friend, um, we were talking and you brought something to our attention. And I was like, I don't know what that is. Perimenopause. Never heard of it before. Didn't know it existed. And you were so kind enough to buy us a book. I had the book. It's in the other room. But you were kind enough to buy us that book so that we could actually read it and get information and just to know what's going on in our own bodies, to be a little more educated about it, because honestly I never heard of perimenopause before. So can you just talk about that for a minute? Let us know, like, maybe when it starts, maybe things that we should know to inform ourselves about, like, okay, this is happening, so you might be in that stage
Right,
type of thing.
right. So yeah, everyone, every woman, everyone assigned female at birth will go through perimenopause and menopause at some point in their life if they are lucky enough to live long enough, right? So,
Mm-hmm.
and it's crazy that we don't know more about it. It really is. Like the to answer your question, so because I like to go off on tangents to answer your question on what it can look like, right? So it can start anywhere, and I'm going to talk about women who do not have another medical condition that might have caused them to have early menopause or um yeah, early menopause, right? Because that's something different. So like if you have a hysterectomy, then that is surgical menopause, right? If you had to have your ovaries removed as well. Like there's different things, there's different um endocrine type syndromes that can make you go through these symptoms sooner. So I'm not talking about that. I'm talking about
Mm-hmm.
somebody who is like physiologically going there in like the way that we expect, right? The first
Mm-hmm.
things that you might notice is a change in your period, right? So if you were like a clockwork type period person, right? Like you
Mm-hmm.
got it every 28 days or every 31 days or every 21 days, you got your period and this was regular. And now it could be somewhere in your 30s, right? Now you're
Mm-hmm.
starting to notice, oh, my period's a little different than it used to be. It now is like between every 28 and every 34 days, right? It's not exactly every 28 days anymore. Or it's a little heavier or a little lighter. You're starting to notice those changes in your period. You're still getting your period and you're still getting it every month, but there's
Mm-hmm.
little changes. That can be the start of your perimenopause journey, right? And it can last for years. It could be a decade, right? If this is happening in your 30s, you might not go get to menopause until 50 or later,
Mm-hmm.
right? So these are, you're talking a couple decades possibly. Um, and the the hot flashes, what you mentioned, is what we mostly know about. That hot flash that your mom or your grandma was like complaining of. She's getting hot, she's
Mm-hmm.
fanning herself and all of that, right? And she's telling you
Mm-hmm.
not to laugh at her, but she's laughing at herself too, that kind of a thing,
Breaking
right?
out in a sweat out of
Right,
nowhere.
right. And but that is just one of the many things that can happen. A lot of people will have night sweats, but not have hot flashes during the day. Like they don't ever
Mm-hmm.
have a hot flash during the day. It's not a thing. But they'll wake up in the night sweating, and they'll
Mm-hmm.
be, a couple that had to change their pajamas, or they just wait. It wakes them up out of their sleep. That is also a vasomotor symptom. Like that sweating, those heat flashes, whether they're during sleep or awake, it's the same type of thing going on.
Mm-hmm.
um, you can have more arthritic type pains, you can have skin changes, you can have more irritability. Like you might just think that, I know for myself, my PMS was getting, I never really had PMS as far as like the irritability and stuff like that. Like maybe
Mm-hmm.
every once or twice a year I would notice like, oh, then when I was like 40, it was like with every single period, I am like the worst PMS ever. I don't want anybody to talk to me, and you better not look at me sideways, right? This is like this is that's part of perimenopause, because your, and what it is just like your estrogen is going up and down and up and down in a way that was is less stable than it used to be, right? It's just kind
Okay.
of all over the place, right?
Mm-hmm.
The progesterone and estrone mainly, and the other um, hormones, reproductive hormones, are also going down, 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 and it's like they never get up to what they would used to be.
Mm-hmm.
So it is a normal change, a normal hormonal change, but it can have a profound effect on our quality of life. And so just knowing that these things are not, a lot of times they're not linked to anything else. It's perimenopause, and there's treatment for it, right?
Hmm.
Um, yeah.
When do you think that somebody should seek help? Like, because some people don't really recognize those symptoms, right? They just think it's kind of just out of the blue 1 month
Yeah.
and maybe happenstance for 3 months, and then it goes away that fourth month.
Right.
Would you suggest that someone seeks support for that?
When it
And
becomes bothersome.
even menopause though.
Yeah. When it becomes bothersome, if some people have the hot flashes, they're annoying, and they're just like, whatever. They're not that bad. Some people have them, they sweat through their clothes, they're really embarrassed by them, they can't take it anymore. It's really affecting their quality of life. It doesn't
Hmm.
matter like to what degree. If it's affecting your quality of life, you can seek help for it. Period. Right? Like it doesn't have to be so bad, or you know what I mean? Like everybody is going to be different on what they can handle, and so you
Hmm.
just seek care when you feel like you need help handling it.
Okay. Yeah,
And
because
the other
that brain fog, it'll
brain
get you
fog is
sometimes.
part of it. There's so much. So there's also like that kind of pesky weight that you gain so easily and is so hard to get off. That's
Uh-huh.
because with the decrease of estrogen, it's harder to lose weight. Like that's just part of it. And it's easier to gain, right?
Yeah.
Mood swings, sleep problems, period changes, brain fog, achy joints, reduced energy, change in your sexual drive. All of these things can be related to perimenopause. And menopause specifically just means it is one day. Menopause is one day. Before that, you're perimenopausal. After that, you're postmenopausal. Menopause
Wow.
is 1 year with no period, right? So you started having these light period changes, and then you started skipping, maybe getting shorter or longer or both,
Hmm.
right? And then they started elongating, and now it's like 3 months or 6 months between each period. But then on the seventh month, you got a period. You're not in menopause yet. You're still in
Hmm.
perimenopause. You have to have 12 months of no periods, a full year of no periods, and then that day, you are now in menopause. And then the day
Wow.
after that, you're postmenopausal, right? Like
Wow.
this,
Okay.
it's really like that year after the last period. That's the
Okay.
menopause day. And a lot of people
Wow.
don't realize that either.
Yeah. I didn't think it was one day. I thought it was
Yeah.
like
Just
for a
like,
while after that.
no, because after that, like, and that maybe it's like a little semantics, right? But
Right.
literally, like, the menopause means you've been a year without your period. So then
Okay.
when you're on day 366, now you're postmenopausal, right?
Okay. Yeah.
Yeah.
Wow. That's something else. I
Yeah.
hope everybody's listening
Yeah. Yeah. And
because that's important.
the other thing that I feel is really important is not being scared of hormones, not being scared of putting estrogen back into your system.
Okay.
We are very cautious about it in our
Hmm.
community. And in general, in this country, we became really cautious about it because of um, a study. The study itself was not faulty, but the way it was interpreted could have been done in a much better way, right? Like originally, the it's the Women's Health Study, and it found that taking hormones increased your risk of like heart disease. It increased the risk of um, so many things. Like we just shouldn't blood clots. We just shouldn't be taking it, right? If you
Hmm.
in menopause. And then when they re-looked at the same study and just were like they controlled for when the woman started taking the medications, right? It was like,
Hmm.
oh, actually, it's protective for so many different things, right? So if you start hormone therapy, which most of the time is estrogen and progesterone, if you have your uterus, you need progesterone because taking Estrogen can increase the risk of uterine cancer if you don't have progesterone to help mitigate the effects of estrogen on the uterus. But when you
Mm-hmm.
take the estrogen and the progesterone together, you're good, right? Like that is no longer a risk.
Mm-hmm.
So, um, estrogen if you've had a hysterectomy for whatever reason, estrogen, progesterone if you have it. And this is everything in medicine is nuanced. It's not the same exact for every woman. Everybody is going to have their different things that they have to figure out with their doctor,
Mm-hmm.
right? But that's just the general how it would be taken. When you start it within the first 10 years of menopause, right, or before age 60, it protects against osteoporosis, which is a huge problem in women. It is protective for um, the brain fog is real. Um, oh my goodness, protective for like Alzheimer's, against Alzheimer's. It and then it helps with all those other things that are the
Mm-hmm.
symptoms that we deal with. And there's even some studies to figure out if it is protective against heart disease or not. Those are still like kind of up in the air. So it's just there's so we don't have to be scared of it. We really don't.
Yeah.
Yeah.
So let's talk about self-advocacy, right?
Yeah.
I complain to you about doctors not hearing me, right? Not understanding me. At least that's how I feel sometimes. Um, what briefly, what do you think, or what's some advice that you can give um, that would help someone to feel a little better about advocating for themselves, and even just feeling dismissed when they're talking to a health professional?
Yeah. It's such a problem. Um, it comes down to like bedside manner and everything that we've kind of talked about already, the broken healthcare system, the time we have with patients, all of that. But if you are really feeling dismissed, like every time you go to this doctor, you don't get your questions answered, it's okay to change. You are not
Hmm.
married to this doctor. And even in married, divorce is okay. Sorry. Some
Hmm.
people don't think so, but if it's not working, get out of it, right? It's not the
Yeah,
relationship
yeah,
for you, right?
yeah. Hmm.
And so and so it's okay to shop around until you find somebody who is a good fit for you and you feel is listening to you. All of that, and knowing that, the time constraints and all that kind of a thing, there are apps for, a patient app for most healthcare practices, where you can ask your questions. Let's say you thought even that you understood what happened in the doctor's office, and then you leave and you're like, wait, what was I supposed to do? Or what were they talking about this? You can message the provider, and you'll probably get some messages saying, we'll answer it within 3 to 5 days or 2 to 3 days or something, but whatever. Ask all the questions you have. Don't be
Hmm.
afraid to do it. They I say that knowing, like, even in the back of my mind, that I even have colleagues that are just like, oh my God, they kept me in the room forever. I was trying to get out and I couldn't I couldn't leave.
Hmm.
They kept asking questions. I know that. And when you're a patient, you feel that, right?
Yeah.
So I know that it's hard to do when someone's trying to rush and you still have your questions, but you have the right to stay in that room until you understand what's going on with your health before you leave. Don't leave unless you understand what's going on. Ask your
Hmm.
questions. Um, like I said, I know that can be hard, but you have the right to do it. You are paying. This is a service that you are paying for. Like, even if you have Medicaid and nothing actually comes out of your pocket, that person is being paid to give a service to you, to provide a
Right.
service to you. So use all of the time that you have there, and then use
Mm-hmm.
all of the other associated things. Like, do the if there's something with a support group, go to the support group. If it's something, you know what I mean, that there is an
Hmm.
app that you can use and ask the questions, right? Like, you send the messages. Yeah.
Yeah, that important. Number one.
Yeah.
So with
And change. Change if you need to.
Yes,
Change the
change.
providers.
Absolutely. So with maternal mortality rates
Mhm.
between the different ethnicities and races, what are what are the differences as far as the rate, the statistics are concerned? How are they measured?
So it's measured how many deaths surrounding um, the perinatal period, so pregnancy and a year afterward, where it had to do with a pregnancy related issue, right? Not
Hmm.
that somebody, I don't know, like was in a car accident, right? Like even if it's a
Hmm.
year after within the year after birth, that would not be considered maternal mortality. But if it's a pregnancy related issue, including mental health issues like overdose and suicide, which are
Hmm.
actually some of the leading causes of maternal death, um, maternal mortality. Um, it's how many deaths per 100,000 women. That's how it's measured, right?
Hmm.
And we are in a real crisis in this country. It's ridiculous. We are like the one of the most wealthy nations with the highest rate. Um, Ours is 17.9 deaths per 100,000 live births. And this was 2024 data. You know, the years take a little bit of time to catch up because they have
Hmm.
to check back, right? And that's for the country. This is CDC info. Black and non Hispanic women, however, the rate is, sorry, Black non Hispanic women, the rate is 44.8 deaths per 100,000. 44. The country's is 17. Ours is 44. White
Mm.
non Hispanics are 14, 14.2. So we are 3 to 4 times dying, 3 to 4 times the rate of white women. Hispanic women 12.1, Asian non Hispanic women 18.1. And then these are like the rate increases as maternal age increases as well. It can be as high as like 63 per 100,000 live births if you're in your 40s or 50s having a child. It's
Hmm.
scary, right?
Yes.
And so, yeah, it's a problem. And most of the important thing though is that most of the causes, oh, don't quote me, but I just was in a course talking about this. It's between 80 and 90% of the causes of these deaths are preventable. What? Why? Why is this happening?
Yeah,
In the
especially if
black
they're
community,
preventable.
in the black community, a lot of it has to do with racism. To put it short,
Hmm.
just
Yeah.
like not listening to women and their symptoms, and it doesn't matter if you control for economic status and education status. It doesn't
Hmm.
matter. We're still worse off than our white counterparts. You can be
That's
rich, you
scary.
can be the smartest person with all the degrees behind your name. It doesn't matter. It doesn't matter. You could pay for the best health care and it doesn't matter, right? Like it just, you're still at that risk.
Wow. Yeah, that's really scary.
Yeah.
That's crazy.
Yeah.
Well, listen. So if someone is watching this segment and something that we've said resonates with them, they want to find a different healthcare provider and they see you, how do how do they get in contact with you? Are you accepting new patients? Are your patients only for those who live in Maryland, since you live in Maryland? How do they connect with you?
Yeah. So the best way right now is to go to SBMD Healthcare. My name is Sha'llah Brewton MD, right? So
Hmm.
sbmdhealthcare.com. And they can fill out the contact me page or contact us page. You
Mm-hmm.
won't get any spam, not even any newsletters yet, nothing, right? So you will get a email from me where you can then email back and let me know what it is what type of services you are looking for. And the type of services that I provide are, again, it's women's health care. So GYN care, menopause care, um, those are through a um, kind of direct care package. It would
Mm-hmm.
be, should I tell about like how it works?
Yeah, you can give a small synopsis, sure.
Okay. It's just you pay a monthly fee, and you have a certain amount of visits per month that you get. You don't have to pay any more for those visits.
Okay.
Um, and that there I provide home visits and telehealth. The
Okay.
main home visits are my postpartum and newborn visit package, right? So I would see the mother and the baby at the same time, starting within the first week after giving birth, so that the parents do not have to leave the house to go to the pediatrician's office, and so that the mother gets early postpartum care. Because that 6 week visit, we didn't talk about this much, but that 6 week visit is too
Mm-hmm.
late for a lot of things that we could have caught early. And that's one of the things that can help decrease that maternal mortality rate. Because not just mortality, it's also morbidity. Morbidity is just different things that can happen that won't cause you to die, but they can make your decrease your health, right?
Okay.
So
Mm-hmm.
mental health issues, infection, bleeding, that kind of a thing, um, can be caught early if you have an early postpartum visit. Part of that, where you have to bring your baby to the pediatrician within the first week of life, and then once a month as well. So that package is really important for taking care of the mom and the baby, so that mom can rest as well and not have to leave the house so often to get the pediatric care that she needs. I'm a family medicine doctor. I don't know if we said that. I think we did in the
Yeah.
beginning. So
Mm-hmm.
I am able to take care of both the mother and the baby. Um, yeah. And then
Okay.
menopause care. And to answer your question, yes, I'm licensed in Maryland. So you have to be in Maryland. And home visits I do in the Baltimore um, County and Baltimore City area.
Okay.
But then telehealth for all of Maryland.
Okay.
Yeah.
Great. Now, listen, I hope that someone, whomever you are listening, watching this segment, I hope that you feel empowered. I hope that you feel encouraged to advocate for yourself. I hope that you um, leave feeling like your health matters, right? I hope that you feel like your questions matter because they do. Um, I hope that you feel like you deserve compassionate care, quality care, because you do. Every life matters. So thank you, Dr. Bruton, for being with us tonight. Thank you for sharing your heart and your expertise with us. I hope that others like us, that look like us, can feel empowered to really go and get quality health care for themselves. So I thank everyone for joining me. Again, if you feel like you want to reach out to Dr. Bruton, please go to her website, sbmdhealthcare.com. Also, make sure you go to our YouTube channel. That's Portia Wheatley, Trophy of Life, and share, like, and subscribe so that you can see other segments like this on different topics that will encourage you and encourage others that you know. So I thank you And everyone have a great evening. Thank you so much.
Thank you so much for having me. It
You're
was
welcome.
wonderful.
You're welcome. I appreciate you. Good night, everyone.
Good night.